The first year I was a standalone SHO in University Hospital Kerry in orthopedics, and during that time I explored a few options and then applied for the GP scheme and Southwest, which I'm currently on as my priority. And I was very fortunate, I got the scheme, and it's I've never looked back since then. It's been an amazing journey since then. When I started out, I still remember in 2017 when I was in orthopedics, and I told a couple of my friends, look, I want to apply for the GP scheme, and they were like, oh, no hope, you might as well go to UK. But I persisted and asked around, and the GP trainees who were actually ahead of me, they helped me a lot with my application. So definitely it's very competitive, but it's not impossible. And if you do the right things, if you have an appropriate CV, if you do the relevant courses, I think there is a good chance that you can make it. And I would urge all non-EU candidates that they must look into the guidance of what to put in their application, and support it with relevant courses and exams. As a matter of fact, last year I was part of a webinar that we arranged to help out all the non-EU candidates in strengthening their application and giving them tools to navigate through the interview process and succeeding. And I'm delighted to tell you that quite a few of them actually texted me back saying we got successful. So there are a lot of success stories out there, so a lot of positives to take from it. While working in orthopedics, I was very keen on joint injections and musculoskeletal pathology. So when I came onto GP practice setting, I realized that there was a big need of it. So I am very keen in developing an interest in musculoskeletal medicine, which means dealing with the joint problems, knee, shoulders, and possibly doing the intra-articular injections. And that's a very important thing, because as there is long waiting time for people to see orthopedics. So if we can provide a service in community, that'll obviously benefit the patients and also take off the load from the waiting list. And secondly, and that's actually a very important one, is the lifestyle medicine. Because I believe as GPs we'll look at patients holistically, and that's the most important part. If the patient's lifestyle is according to what we consider healthy in today's day and term, I think they will prevent a lot of problems, and they'll stay away from a lot of conditions. And that's the key to healthiness, and promoting a general healthy attitude, whether it's diet, exercise, mood, avoiding burnouts. And so I'm very much up for that, and I really like talking to patients about that, making small changes that can impact their life. So that's something I'm working on. So the best thing about general practice is general practice is referred to as family doctors or family physicians in various countries, and I feel that we are in some way an extension of family members. We look after when somebody's from a young age to when they are old. We advise them on behaviors that will be healthy for them, and we promote healthy behaviors, and we ask them not to do those things that can be harmful. In some way we're keeping an eye on them and making sure everything is ticking as it should be. I think the second thing about general practice is that it's quite variable. It has a lot of variety. You can set your own career as your own, it matches your personality. Furthermore, every place you go, I think you can make changes that are very valuable, which I felt in hospital there was more resistance to. So general practice, you can make more changes and lead to better health outcomes.